Hello, I'd like to welcome everyone to our webinar today. This is OptiMed Health Plans, and today's webinar is going to focus on specifically our new short-term medical options that we are now offering. If you'd like information about our other products, or for those of you who have signed up for the short-term medical webinar today, we also at OptiMed do gap insurance, where we insure deductible and co-insurance on major medical plans, which is our most popular product by far. Limited benefit programs, minimum essential coverage products, self-funded major medical, dental and vision products. If you'd like more information on those or like to learn more about those, or want more information, obviously, on the short-term medical webinar that we're going to have today, feel free to reach out to your group health representative here at OptiMed Health. You should have received the invitation from them. You can reach out to them, and I'll have our general contact information at the end of the webinar. So if you don't have that or lost the email, you can write it down and give us a call. But we're going to get started today, but today's focus is specifically going to be on, again, short-term medical. So let's get started. Now, when we're talking about short-term medical, what we're going to do is get into a little bit about, an overview of short-term. And the why, why would you want, or why would an individual want short-term medical insurance? But we're also going to take a look at things like plan design, eligibility, enrollment, and post-sale. So first, let's get into a product overview. When we're talking about short-term medical insurance, there's two types. There's standard, and then there's guaranteed issue. Now, guaranteed issue, pretty simple, it's guaranteed issue. With standard, essentially standard means health questions, which we'll get into a sampling of those health questions later on in the webinar presentation. But that's really the two types that we have currently right now, standard and guaranteed. The policy coverage terms that are available right now are between 30 days and 3 months. Most of you who are on this call or on this webinar have probably heard about the new legislative changes when it comes to short-term medical programs and how they've extended the period of time that you can write those. Presently, we're still at 30 days to 3 months. We anticipate having longer policy terms in the next 60 to 90 days, somewhere around October to November is the anticipated time span when we'll be able to offer those longer terms. For right now, again, it's just 30 days to 3 months. And when and if that does change, we'll be sure to send out a newsletter blast to you and shoot you an email to let you know that that has changed. We do have broad state availability. I believe it's available in around 40 states or so out of the 50. And the District of Columbia, it is available. So it does have broad state availability, and standard and guaranteed issue policies can exist in multiple states. So it's just not one or the other. Usually states will have standard issue, and then some states have guaranteed issue. But it has an easy enrollment process, and that's what we're trying to do, is not make this overly complicated. But you want to make sure and just take a brief note that some of the short-term medical plans that we offer are only available through the Life Association membership, which I'll get into the Life Association and what that gives the members when they enroll in it. But essentially, in certain states, if you're not part of the Life Association, you can't enroll or take the short-term medical program. But it comes together, so it's not like they have to take an extra step and contact a different entity to get enrolled into the Life Association and then try to apply for the short-term medical. It all comes together. So why would an individual want a short-term medical plan, right? So there's a few different opportunities that present themselves when we're talking about short-term medical, as far as an agent or a broker to sell it to a person. Now, we want to make sure that we understand this is an individual policy, right? So when we're talking about selling it to a group, it's really not you're going in and selling it to a group that you're looking to replace their current major medical program with this, short-term medical. What you're doing is those individuals, as you see on the screen, that let's say maybe missed open enrollment inside the group and don't have a qualifying life event to enroll in the group major medical program, but need health insurance right now, those are perfect individuals that you could market this to a group and say, Mr. Employer, Mrs. Employer, I have, you have an individual, they don't meet the waiting period, or they missed open enrollment. They don't have a qualifying event in order to enroll in the major medical program, but I do have a short-term medical program that I can offer them in the meantime until open enrollment comes around in XYZ. So it's a good opportunity where you can take an employee that is going to be very unhappy because they somehow missed their open enrollment period or don't have a qualifying event but need health insurance right now, and essentially can't get onto the group major medical program, where you can offer a short-term medical solution to that individual. You're also going to have individuals who are, close to achieving Medicare. Maybe they're retired, maybe they're still working and don't have access to Major Med through the company that they're working for. And essentially they're waiting for their Medicare eligibility to kick in, but they just haven't achieved that age yet. With short-term medical, you could take that individual, put them on a short-term medical program until their Medicare eligibility kicks in, and they can go on to a Medicare plan. And, you can obviously talk to them about, Medicare supplement policies. But it's a good solution for those individuals that maybe retired early or are working for an employer that doesn't offer major medical insurance, and they want something in between now and the time that they become Medicare eligible, because in a year or two they're going to become Medicare eligible. So I'm just looking for something for the next year, 6 months, whatever the case may be, until I hit my eligibility. So that's another good opportunity. International students. So you have an international student that's coming here for schooling, and they need health insurance while they're residing in the United States. Another good opportunity to take an individual who's here as a student, put them on a short-term medical plan, because they're only going to be here for, let's say, maybe a semester. They're only going to be here for, let's say, 4, 5, 6 months. So they don't even need a full year plan. So you could put them on a short-term medical program and achieve what they're looking for, which is medical insurance while they're here in the United States for a short period of time. Those people who are, waiting for benefits to begin in a new job. So, for example, an employer calls you up and says, yes, we want to hire this person, but we have a hard 90-day waiting period, and they need medical insurance today, or they might not take the position. Well, you can offer them a short-term medical program for the next 90 days, 3 months. And while they wait for their eligibility to come up on their medical program through the group Major Med. So this way the employer can offer benefits to that employee immediately, or potential employee immediately, and then keep their hard 90-day waiting period, because they're probably not going to change their entire waiting period for their group to just hire this one individual. Plus, they probably just can't call their major medical carrier out of the blue and say, hey, I want to change my waiting period from 90 to first of the month following hire date, in mid-year. A lot of carriers are probably going to not allow that until, they renew again for the following year, just to make those changes, at any point in time. So those are very good reasons. Another good reason would be if you have an individual who goes to healthcare.gov and doesn't qualify for subsidy and looks at the premiums on healthcare.gov and says, they're just not affordable to me. I'm not, they don't qualify for subsidy. They have to pay the full amount. And based off of their age, they take a look at those rates and they just say, I just can't simply afford that. But I really do want and need health insurance. So what other options are out there for me? And a short-term medical program could be a very good option to that person, as they, can afford a short-term medical program and obtain health insurance rather than go without it, because they just simply can't afford the premiums, for a major medical program, because there's no subsidy helping them out because they make too much money. So they just over that threshold of where they would qualify for a subsidy. So it's not like they're making millions and can't afford it. They're making maybe $50,000, $60,000 a year and don't qualify for a subsidy on healthcare.gov would take a look at premiums of like $200-300 a month for a major medical program and just simply can't afford to pay $3,000, $4,000, $5,000 annually for health insurance. And on top of that, maybe have a $4,000, $5,000, $6,000, $7,000 deductible on top of that they have to meet before the health insurance kicks in. So a short-term medical program could be a very viable option for that individual in that it could be more affordable than the premiums on the exchange program and give them the coverage levels that they need as far as health insurance that they're looking for. Just a note as well, you'll see on the side that short-term medical programs are not minimum essential coverage under the Affordable Care Act. So you just want to take note that, short-term medical is not minimum essential MEC under the eyes of the ACA. So we talked about standard issue, right? So in the states below on your screen, these are the plans available for standard issue. And again, when you hear standard issue, you should think health questions. So we're taking a look at a plan deductible. Your first plan deductible is $1,000 deductible. It has 50/50 coinsurance, a maximum out of pocket of $3,500, and a coverage period maximum of $250,000. Now, coverage period maximum is coverage period maximum, meaning if you're selling a 30-day policy, that is the maximum the plan will pay for those 30 days. If you're selling a 3-month policy, that's the coverage period maximum for those 3 months. So just make a note of that in your head, that those are the coverage period maximums. That's why they call them coverage period maximums, is that if you're, depending on what period you elect, 30 days, 90 days, that is the benefit maximum during that coverage period of time. But as you can see, there's a bunch of different deductible options. You got 1,000 up to 25,000. You have coinsurance levels from 50/50 to 100% to 80/20. You have out-of-pocket maximums that range from 3,500 to 27,000. But that's what it is flexibility. You might have an individual that does not care about a $25,000 deductible because they're healthy. I rarely go to the doctors, but I'm worried about catastrophic losses. So if I had $1 million policy that would help me pay for anything in case something happened to me, I had an accident and was in the emergency room, and I have this gigantic emergency room bill that's going to slap me in the face. I want coverage for those types of things, right? If I get sick, I can just go to the Minute Clinic and get a prescription at the Minute Clinic. I'm not worried about that for Tamiflu because I got the flu. What I'm worried about is catastrophic losses in case I get, severely injured or, have a disease that I'm hospitalized for. But then again, you might have somebody that goes, no, I don't want a $25,000 deductible. That's way too high. I'm looking, well, guess what? You have $1,000 deductible option there with a $3,500 maximum. So you have, the point of that is you have a wide range of options that you can offer, individuals that are looking for short-term medical. Now, in the following states, as you see below, you also on standard issue have deductible options that range from about $1,000 to $2,500, but you'll notice some of the plans are different. So, for example, it's $1,000 deductible, 50/50 coinsurance, but the max out of pocket is not $3,500; it's $6,000 in some states, and your coverage period maximums are still relatively the same at $250,000 and $1 million. So you just want to take note. My advice is to talk to your group health sales representative here at OptiMed Health Plans if you're in a particular state, because there are other nuances that we'll get into depending on what states that you're in, or that, and it's really where the member resides in. And that's something you want to take note too when you're talking to employer groups, is that this is an individual product based off of the state that the individual resides in. So if you're talking to a national company or an employer group that has, multiple locations throughout the United States, if they hire somebody and they're looking for coverage for them during their 90-day wait period, if they reside in the state that we don't offer short-term medical in, that's not going to be a solution for them. So you want to take note of the state that the employee, or the member, the individual resides in, especially if you're going to talk to multiple location employers that have locations that are outside the state, or national employers about this. just make note that in certain states you're not going to have availability. Now, there's also guaranteed issue. But when it comes to guaranteed issue, there's only two plan design options. Your first plan design option is a $3,500 deductible. Your second is $5,000. You can either have 80/20 coinsurance on the $3,500 deductible or 90/10 on the $5,000. The out-of-pocket maximums are the same at $10,000, and the coverage period maximums are different than the standard issue. Those are $100,000. And it says guaranteed issue plans are subject to pre-existing limitation conditions. So you want to make special note of that there is a pre-X on guaranteed issue products. Now, as far as the network goes, the network on the short-term medical programs is Aetna. And most of the individuals that are on this webinar probably know the name of Aetna. I mean, they're a very large network and medical insurer. They have over 660,000 medical providers nationwide and over 5,600 hospitals contracted. The Aetna network that we are using for the short-term medical plan is their Aetna Open Choice PPO network. So you want to make special note of that. And really, when you're selling this to an individual, you just want to do a provider search in their zip code through Aetna. You can go onto their website, choose the Aetna Open Choice PPO network as the network, and take a look at the zip code that the employee resides in or individual resides in, and just make sure that they have providers in their area. You know, you can do it by radius, like 5 miles, 10 miles. Obviously, if you're, more rural, you want to expand the radius from, a mile or two to, maybe 10 to 15. But you want to make sure that there is access to providers in their area that you're selling this in, or the individual resides in. Just make sure that they don't have to travel 50 miles in order to see a provider if they sign up for the insurance. Now, plan details. Doctor office visits are covered under the program, but they are subjected to deductible and coinsurance. You have benefits for urgent care. You have unlimited visits. The insured pays a $50 access fee per visit. But you want to make sure that you understand that the plan deductible is waived, which is a good thing, but the visit charges are subjected to coinsurance. So again, unlimited visits, a $50 access fee per visit. The deductible is waived at urgent care, which is good, but the visit charges are subjected to coinsurance. Now, when we're talking about emergency room, different story. Again, it's unlimited visits. The insured pays $250 for an access fee, unless they're admitted. But the visit charges are subjected to deductible and coinsurance. So that's something they would want to take note as an individual who's enrolling on the program, that if you're going to an urgent care facility, you're essentially going to owe less out of pocket. I mean, your access fee is $50 compared to $250, and those charges are going to be subjected to deductible at an emergency room where they are not in an urgent care. It's just coinsurance. There's also benefits for ambulance. There's an unlimited amount of trips that you can take, but the plan pays $250 per trip. That's not a copay. That's the actual benefit amount that the plan actually pays, is $250 per trip. And as you'll see at the bottom, there's certain states that have a $50 first dollar benefit for the first doctor's office visit. So if you're in one of those states, Colorado, Florida, Ohio, Maryland, New Mexico, Oregon, Utah, if the member resides in that state, they're going to get a one-time $50 benefit towards their first doctor office visit. And then the subsequent visits will apply to deductible and coinsurance. Now, I mentioned the Life Association. In certain states, you have to be a member of the Life Association in order to enroll into the short-term medical program. It's bundled together. It's one and the same. You become a member of the association once you enroll into the short-term medical program. So it's not, again, we're trying to make this inconvenient for the individual where they have to go to a separate website and a separate place to enroll in the Life Association, then come back and do an application online for the short-term medical program. If you reside in a Life Association state, you're going to become a member of the Life Association once you enroll in the short-term medical program. But the Life Association is non-insurance. These are non-insured benefits. So you have non-insurance benefits like TeleMed, which you can consult with a physician via phone or, or video to get a consultation. There's no charge or extra out-of-pocket expense for the member for that consultation, which is a phenomenal feature, especially when doctor office visits are subjected to deductible. If it's something as simple like I got the flu and I just want a prescription for Tamiflu, they can go ahead and use the telemedicine and get a prescription for that Tamiflu over the phone. RX discounts, there's pre-negotiated discounts for prescription drugs that they can utilize through the Life Association. Hospital negotiation services, so if they have a large deductible and there is a large bill and then the member does not have the money right now to pay for that, if they call the Life Association, they can help potentially negotiate that for the employee. They remember they can call the provider and see what they can do about sending up payment or lowering the amount. It's basically a patient advocacy service that the Life Association's offering. There's also discounts on direct lab services that you get through the Life Association. But in addition to, health insurance benefits, there's also things like identity theft, auto discounts, travel, and dining discounts. So it's not just being part of the Life Association doesn't just give you the telemedicine. It also gives you all these extra added features. But again, these are non-insured benefits. The state availability, those are the states that have life. You have to be part of the Life Association. There's no states. There are some that are available without. But again, if you have questions about that, you should call your group health sales representative here at OptiMed, and they can walk you through if the state that you're selling in or the member resides in is a Life Association state or not. Eligibility. So, as far as age is concerned, the primary applicant can be from 60 days old, and again, that is 60 days old, up to 64 years old. Children on their parents' plan can stay on the plan until age 26, but you can do child-only applications. So you can have a child 60 days or older as the primary. If there's multiples, you would list the oldest as the primary. Now, when we talked about standard issue, again, we were talking about health questions. So here are some of the questions that are going to be asked when you're doing a standard issue short-term medical policy. So you have, questions about pregnancy, weight, mental illness, HIV. There's also going to be questions if you've had any diagnosis, treatment, experienced symptoms of things like cancer, stroke, diabetes, kidney disorders. They're going to, and that's 5 year, within the last 5 years is that applicant. So they do go back a little ways. So when they're doing a standard issue policy, you just want to make sure that the member, if it's just as simple as taking a pill or being consulted on, diagnosed with any one of these things, they have to answer yes. Now, the good news is that if they do answer yes to one or more of those health questions, they may be able to roll into a guaranteed issue plan. The states that they're available in are on your screens right now, but short-term medical guaranteed issue plans do have a pre-existing limitation condition on them. So you want to make special note that there is a so just because you're doing a guaranteed issue product and they answered yes that I've been diagnosed with cancer in the last 5 years, that when they're doing their look back on the pre-existing limitation condition, if they were, treated for that cancer within the last 6 months prior to coming onto the short-term medical plan, most likely those claims are going to be denied on the new short-term medical plan that they're enrolling in because there is a pre-existing limitation condition on there. So you just want to make special note of that just because you're doing a guaranteed issue policy does not mean that the health condition is going to be automatically covered. But those are the states that it is available in, but it is a definite option for, to get somebody enrolled who maybe had something in the past but are not getting treatment for it currently, but, want to get a short-term medical policy and not be denied for it. Some limitations, exclusions, like I talked about, pre-existing conditions, maternity, things that were incurred, expenses incurred outside the United States, acts of war, mental illness. If you're going to sell the program, contact OptiMed Health and get a brochure that will give you a full list of the policy limitations and conditions and exclusions. So this way you'll know, and specifically if there's a particular state that you're working, if there's something, we can get you a state specific brochure if there's something particular to that state. But the big takeaway from this is that there are limitations, there are exclusions. This is not a complete list of what we're showing on the screen. You want to kind of make special note that these things do exist, and that you want to make sure that when you're selling it, that you get the full list of exclusions and limitations from the brochure. Now, I touched on this briefly, but the great thing about these short-term medical programs is that you can write 4 consecutive plans with just one application. So when a member wants to enroll, or an individual wants to enroll in a short-term medical program, but wants longer than, let's say, a 90-day period, a 3-month plan, you can actually write 4 consecutive 3-month plans, 12 months total, with one application, which is a very convenient option that we offer here. So the applicant would apply once, and there is an initial application fee that they would pay. So they would apply once, they would enroll in the plan, but they would enroll in 4 consecutive 3-month periods. The other phenomenal thing is that the pre-existing condition look back is based off the policies, the initial policy's first effective date. So if you wrote it for effective 9/1, right, the pre-existing condition look back period is 9/1 going back. When they have their new policy that kicks in after their 3-month period is over, so 9/1, 10/1, 11/1, when 12/1 rolls around and they go into their second policy period, that pre-existing condition look back is still only 9/1 going back, not 12/1 now going back. So those are 2 very big bonuses in offering this short-term medical program. And again, is that you can write 4 consecutive, so essentially you can write a year, but each one is its own separate plan. But the good news is that there's only one application fee. And secondly, you're only looking pre-existing condition back from the initial policy period. Other things you want to note when you're selling 4 short-term medical plans in one application is that the deductible, the max out of pocket, and the coverage period maximum reset with each policy. So if you wrote one for 9/1 and you wrote it for 3 months, you have a $1,000 deductible with a $3,500 out-of-pocket max between 9/1 and 12/1. That is going to reset 12/1 to 2/1, and again, it's going to reset again through 1. It's going to reset, but also the coverage period maximum resets as well. So if it has a $250,000 coverage period maximum, that resets each policy period as well. So that's going to reset on 12/1 and then again on 2/1. So those are the good things about the program, and some of the negatives of that. Yes, your accumulators are going to reset each policy period, but so does your benefit coverage period maximum. The other things you want to note is that you must have the same plan design. You can't switch plan design, so you can't have a $1,000 deductible from 9/1 to 12/1 and then go to a $25,000 deductible for 12/1 to the next to 2/1. It has to be consistent throughout. So you have to pick one plan design that you will have for all consecutive 4 periods. The members have to be the same during those 4 consecutive periods. And what the customers are going to do, or the individuals who want to sign up, is that they're going to complete the acquired questionnaires, right? Those health questions. They're going to give their yes or no to those, and then they're going to pay their monthly premium payments on time in order to remain eligible for all the plans. This isn't available in certain states. So to the right-hand side, you'll see it's not available in about 7 or 8 states. There's some states where they have an option to purchase 2, but not 4. You want to take note of, again, states to state, and that's where I'll constantly keep repeating myself, the best option is after the presentation is to reach out to your OptiMed sales representative and tell them that you work in XYZ state and that's where your business is going to come out of, and what are the policy, limitations, conditions. Can you send me over a brochure that applies to that state? And secondly, what are the nuances? Can you write 4 consecutive policies? Can you go ahead and have guaranteed issue and standard issue? What standard issue plans are available in those states? Your group sales representative can let you know all that information. In addition to the short-term medical plan itself, there are other coverage options that you can choose from. Things like critical illness, term life, dental PPO, and indemnity plans. There's a lot of different enhancers. That's one of the plan enhancers. So you have things that you can add to the short-term medical program to make it even better. So at the time of the initial application, it'll give you the rates for the short-term medical program, but it'll also give you if there are options for these. Again, certain states have these, certain states do not. But if the state has the available options for these to choose from, it'll also give you the options of adding these enhancers to or riders to the short-term medical program to make it even better, because maybe the employee or the individual doesn't have the money to pay for a whole life policy, but would like a term life policy. And if you can offer it with your short-term medical program, why not? So those are the things that you want to take note of, is that when you're taking the initial application, those things should appear if it's available in the state. If not, then it's most likely not available. Now, as far as enrollment goes, coverage can start as early as the next day after application. The coverage terms, again, 30 days, but no more than 3 months at this point. And what's going to happen is there's going to be an initial payment at the time of the application. So there's an application fee and there's going to be an initial payment drawn at the time of application. If you're doing a 4 consecutive plan option, you can either set it up monthly, so where the recurring payments are drawn 5 days before the anniversary start date, or if they're just doing one single option, they're just doing one 3-month policy, they can just do single payments, where the premium is just paid in full at the time. The way you can pay is either through EFT, Visa, MasterCard, or Discover. Now, again, enrollment rewrite policies, when we're talking about these 4 consecutive terms, there are, again, states that have limitations. As you can see up there, pick one, Kansas and North Dakota limited to 1 rewrite. I'll reiterate it again. You want to talk to your group health sales representative here at OptiMed and let them know what state you work in, and they can tell you if there's something in your state that would limit you from writing a 4 consecutive policy term. So just to recap, Aetna is your network, and it's the open choice PPO network, so you can go in and do a provider search for an individual that may want to enroll. In certain states, you have the life association membership that's required, and with that comes things like telemedicine, discounts on things like identity theft and auto insurance and travel. It's a nice little feature to be able to be part of that association and get those additional non-insured benefits. But essentially, short-term medical fits the needs of many customers because it fits their budget, right? I want health insurance, but I can't afford a comprehensive major medical program at this point because I don't get or qualify for a subsidy, and I can't afford the premiums, but I want something right now. Or employer groups that don't want to change waiting periods or have employees that missed open enrollment that, need health insurance today, but you don't have any other options for them, right? You can't force the major medical carrier to enroll them. They missed their open enrollment period. You can't change the waiting period on the group just because you want to hire this person. So it has options to fit not only needs, employer needs, individual needs, and also their budgets as well. Remember, there's a $50 access fee for urgent care visits, and those visits are subjected to coinsurance but not deductible, which is a very good feature. You can enroll or have a primary applicant as young as 60 days, which is, unlike anything I've ever seen. You can actually enroll somebody who's a 6-year-old onto this plan as the primary applicant. And there are guaranteed issue plans available in certain states. So again, you would want to check on which states have guaranteed issue options. That concludes the webinar presentation for today. I'd like to thank everyone who took the time out today to learn about this product. And again, if you have questions or want to get more information, learn how to get contracted to start selling this. Essentially, contracting is very simple. We'll be sending your group sales representative will send you an email link where you'll go ahead and fill out your contracting paperwork online. So it's very convenient. Once you filled out all your contracting paperwork and got all the, T's crossed and the I's dotted, you'll get a link where you'll be able to go in and then start running applications for the short-term medical product. And then it'll ask for things for like age, and if you're doing a standard issue, it'll ask you medical questions for that individual, and those individuals will have to answer those questions, or you can do guaranteed issue, and then it'll give you the rates. And then if they are interested, again, like we were talking about, there's an initial application fee, but then if they're doing a one-time, let's say 90-day policy, they'll pay their, they can either they'll pay the whole thing up front for their 90 days. And then they can get coverage as soon as the following day. Or B, if they're going to do the consecutive terms, writing a 3-month policy on 4 consecutive terms, you can set it up to where their payments will come out automatic draft 5 days before their next period would start. So it's fairly simple. It's fairly easy to get quotes and do applications. It's really just once you get contracted and set up, you can start quoting as many people as you like. And that's the beauty of this, and it's fairly simple. It's all automated. It's not like you have to do paper applications and have somebody fill it out and then fax it or email it and scan it over to. It's all done online, so it's very convenient. So that's it. If you don't have the email invitation with the contact information for your sales representative here at OptiMed, you can call 800-482-8770. Just press the option for sales when you call into our main line, and you can talk to a group sales representative here. You can also email sales@optimedhealth.com. And the email address is sales@optimedhealth.com if you don't have the email address for your group sales representative that sent you the invite. But this pretty much concludes the presentation for today. And again, we do other things other than short-term medical, gap insurance, and that's not Medigap. It's gap for groups who we insure deductible coinsurance as it applies to the major medical program. It's our most popular product, so if you want information on that, feel free to reach out to us, or on limited med, minimum essential coverage, self-funded major medical, dental, or vision. And thank you again for attending, and we look forward to working with you in the future. Goodbye.